Hi, we are here with Dr. Glenn Nielsen, neurophysiotherapist at St. George's, and he specializes in FMD, and he's here to talk to us today about the trial that they're doing with physiotherapy currently. Hi, Glenn, how are you doing?
I'm very well. How are you?
Great. We really appreciate you joining us today. And because of scheduling, we've done some pre-recording, so we won't be asking any questions. But the work that you're doing is so important that we want to take a few minutes to kind of get an update. We have talked about it before, but we just want to kind of hear a little bit more about what's going on. The current research trial is called Physio for FMD. Can you give us kind of just a brief kind of overview of what that looks like?
Okay, so the long title is called A Randomized Controlled Trial of Physiotherapy for Functional Motor Disorder. And we're testing to see whether physiotherapy is a useful treatment for functional motor disorder. And to do that, we are going to randomize 264 people with functional movement disorder who choose to take part in our trial to have one treatment, which is a treatment protocol that we've come up with, and that's 9 sessions of physiotherapy over a short period, so over 3 weeks. Or they might be randomized to treatment as usual, which is treatment to see a neurophysiotherapist, or physiotherapy suitable for somebody with neurological symptoms. And so we give a whole lot of questionnaires to assess people's problems with mobility and a few other types of things before they have treatment. And then we assess them again at 6 months, and then finally again at 12 months. And then a group of statisticians and health economists will look at that data to determine if, firstly, if physiotherapy is helpful, but if one of the treatment arms is better than the other one.
Great, thank you. That sounds quite labor intensive to go through all of that. I was thinking, you know, the difference between the two groups. I'm glad to hear both are getting treatment, correct? It's just the difference of specific to FMD versus the other, is that correct?
Yeah, that's correct. So it's not a placebo trial. Both groups are getting what I hope would be very good neurophysiotherapy. One group has sort of a protocol that we've developed. And I guess what we want to test is whether or not it's useful. We don't know. It might be just as good as normal physiotherapy, or perhaps normal physiotherapy might turn out to be better. So what we hope to do at the end of the trial is to find some evidence that physiotherapy is useful for people with motor symptoms. And then we can use that information to go to the funders for treatment to say it's a worthwhile treatment and you should be paying for this treatment for people with these types of problems.
That's great. That work is so important in this area. I also want to clarify, because we are using the term FMD for functional movement disorder. And as you mentioned, the motor skills. Can you maybe give just a quick view of why that term is being used versus functional neurological disorder, and maybe what that has to do as far as who's recruited and who's not?
Yeah, it's a good question, and it's a really complex one to answer. I guess because physiotherapy isn't necessarily a treatment for functional neurological disorder. Physiotherapy is a treatment for movement problems. And so specifically, we're looking for people who have movement problems associated with FND. So the types of symptoms that we usually see are people who have weakness that prevents them from walking or using their arms properly. Some people have tremor. Some people have what might be called functional dystonia or abnormal postures. They're probably the main ones. Sometimes we also see people who have jerks that are quite similar to tremor, or it can also be called myoclonus. But they're the types of things that physiotherapy might be involved in trying to help.
Great. And how is the recruitment process going? Can any of our viewers that are probably watching this now, can they go somewhere to sign up for it, or how does that work?
So again, research is always complex and never as simple as you'd hope. So the trial is funded by the research arm of the NHS, and what that means is that The participants of the trial need to be in the NHS, and they need to be referred to a neurologist in the NHS. So they need to go through the normal NHS sort of pathways to be considered for the trial. And so they need to be seeing really one of the trial neurologists at one of our participating sites. Should I tell you the sites that are involved in our trial?
That would be great.
Yeah, starting from the north, we've got so many now, reading from the top of my list, it's Dundee, Edinburgh, Liverpool, Nottingham, Salford, Sheffield, Bristol, Dorset, and we have 2 sites in London, that's St George's, where I am, and King's College Hospital. So it's a huge amount of people, and in that we have about 15 or so physiotherapists doing the trial intervention. We've got about a little over 15 neurologists, and then there are the people involved in helping recruit and manage the trial. So that's another 20 to 30 people at least, probably more, all in keeping this trial up and running over the next 3 or so years.
Wow, that is a lot of places and areas. So it's great to see that you're getting a wide variety across the UK and giving that access to more people in various areas. So that's great to hear that you're doing that. Go ahead.
I was going to say, one of our goals for the trial was, I guess, to spread awareness around the UK and not just have one central place, say in London, where people have to go for treatment. What we really want is to try and disseminate this so every area has access to, or as close as possible to, specialist treatment and experienced doctors and therapists who can help people. So it was really important for us to get that geographical distribution. And we were so pleased that the therapists around the UK were very keen generally to take part in our trial, and we didn't have too much of a problem to get these 10 sites, despite each site not actually getting a lot of extra funding to take part in this trial. So a lot of the work that's done in this research is done off a lot of goodwill rather than extra payment. So it's a lot of extra work for people who are putting in the effort, because these people realize it's a problem that's worthy of the attention.
That's so wonderful to hear the involvement that the medical community is willing to put forth in that to try to change things. So I think that's really important that you do mention that. So thank you. I think another element that I'm kind of seeing that's also important is that you obviously had to train other physiotherapists to replicate this and duplicate it in several different areas. That's really key in order for it to then roll out. If we do find that it is helpful, that we do roll that out to so many other places, countries, and can have it anywhere. Did that take a lot of time to get the training in that, or is that a question you can tell us?
Yeah, of course. So my colleague Kate Holt and I have been working on developing a training package for our specific protocol for quite a few years now. And so we finished that off for the trial. So the physiotherapists involved in the trial, they came down for a week, very intensive training. And as part of their training, they were treating people with functional motor disorders and learning at the same time. So going through steps of the intervention and understanding. And so a lot of people with this problem contributed to that training. So we have, I think, 11 physiotherapists trained in our intervention, and each one of them have done the week's full-time training. But also we picked people who brought with them a lot of experience. So they were all experienced neurophysiotherapists to begin with, and they'd all had a fair degree of experience or seen quite a few people with this problem before coming into the trial. So it's probably important to realize that it's not something, I think it requires a bit of skill to help these sorts of problems. It's not a simple recipe approach.
Great. Now, as you're talking about other physios learning this program and disseminating it throughout the UK, after the trial is complete and all the data has been analyzed, if it is found useful, we don't want to taint those unbiased views that may be out there, but how has there been any thought of maybe making it an international trial and taking that research protocol to other countries, or there are some other possibly similar things going on, such as the US, Canada, and Australia. Has there been any thought in how that would maybe then?
We're in sort of, it's a small community, so I'm in contact with people from America and Australia, and we'd certainly would like to do something internationally in terms of research, but we will definitely do things in terms of disseminating the information from the trial. So all of the information will be available on the internet, is my plan, after the trial. There are certain things we need to keep sort of under wraps during the trial, and that's just how trials work, because if both groups receive the same treatment, it's really a test of nothing. But yeah, so it's one of the important requirements of a funder is that we detail a dissemination plan, which is to explain how we're going to get the information out there. So we'll certainly be rolling it out across the NHS if we can. And we'll be running courses, and we'll be encouraging people from overseas, if they would like to join our training, they'd be very welcome. And we would love invitations to go to other places overseas as well. So we'd definitely like to hear that. Kate and I love to travel.
Great, great. Is there anything that maybe we haven't had a chance to talk about that you would like to add regarding the research or any other research going on?
I can't think off the top of my head much else. I think this is takes up an enormous amount of my time, and it's I think it's going to be really worthwhile, if at the very least increasing awareness and understanding. But yeah, stay tuned. We'll certainly, it's not the end of our research. We're always looking at new things that we can add within our services. So there will hopefully will be more to update you with in the near future.
Great. And I think that, you know, we all have to keep in mind, because we're so anxious for this information to come out, right? Because we want these results. You know, I think back when you were approved and you got the grant, that was, I believe, around the time of the Edinburgh conference.
It was, yeah.
And then I'm trying to think, I think it was even almost a year, or maybe you would probably know the timeline off the top of your head. FND Hope had written a letter to say, yes, please support this. So there's a lot of things that go in the background and have been going on. You've been working on this project for a long time, so we really commend you for working hard and keeping persevering through all those probably obstacles that came up along the way. And when will the results most likely be available?
So timeline, it is slow, but they're coming. So we need to involve 264 people in our trial, and treat them, and that's going to take quite a while. So we hope to have recruited everybody by May next year, so not too far away. And then in the trial, we're going to follow them up at 12 months after their treatment, really, to see if the treatment is effective after 12 months. And that's the important thing for big research trials to do. So that means we're not going to have that data available until about May 2021. And then we need to give our health economists and statisticians a few months to analyze all that data. So I think I'm hopeful that by the end of 2021, which is only a couple of years away, that we'll have a definitive result to share with you.
Well, we'll be here, and we look forward to having updates and things along the way. We also want to just mention, everyone, part of the reason why we're doing this interview is for FND awareness. World FND Week that will run this year, 7th through the 13th of April. And so we just want to encourage everyone to really put their stories out there and be vocal. And we really appreciate that your willingness to share your work with us.